Hello, hello. Good evening, everybody. How you doing out there in social media land? Welcome on in to another installment of Medical Talk in Layman's Terms with Nurse Charlene. And I am what? I guess Nurse Charlene. Welcome on in, you guys. Y'all see me. I get my Picasso on. I'm dedicated to what I do for you guys and for myself because remember, I'm a student all the time. And anybody that tells you that it's nothing that nobody can teach them, they're probably a fool and stuff. I'm not and stuff. So welcome on in. The topic tonight is so last week we did debunking supplements and all of that, this sea moss and this so and such and all of that stuff, and all our vitamins and everything we take and how we think we're, being healthy, which we're trying. So you are making a good effort. You get an A for effort and everything. So today, the topic is eating disorders when food isn't just food. So wait for me to dig on into this one for you guys and stuff. I got to put a couple people on and everything. One is my mama. Oh gosh. You put two iPhones together and they morph each other or something. I don't know what that is, but it's crazy. And stuff. So here you go, Mama Dearest, and everything. And then also what else did I want to say? Oh, so before I get started, I got to do my pod. Look at my second nurse, second in command or third in command. No, and so my mama, she said, "Do your disclaimer." Yeah, I gotta put out that disclaimer and stuff because that's how we keep on staying on here, getting on down and stuff. So with that being said, okay, now I got it, because I got to see the comments because sometimes I don't see them. And please, nobody get offended if you come on and you say something and I don't see it. It's only because, I'm trying to keep up with them and everything. So I have two different ways of looking at them. But every once in a while, it doesn't happen, and stuff. And so I can't, do anything about it. But I tell you this thing, if you go back to any replays or anything, especially on Facebook Live where I'm under Charlene Nurse Allen and stuff, you will be able to go back and see that I actually go back in and I answer all the comments, or I make a comment to a comment, or I thank somebody or something like that and stuff, because I treasure everybody that comes on. You could be anywhere else in this world right now and stuff, but you're on social media watching, your neighborhood girl, it's a lot of family that comes on. It's a lot of good friends, people I grew up with and people I meet out on the streets in everyday life and stuff. And they're coming on, they're watching and stuff. This is taking off, this is doing what it's supposed to do and everything. But it's all in the name of informing you so that you don't go through life not being able to nowhere near navigate the healthcare field. So I might not be able to fix a car and everything because I'm not a mechanic, or I'm not mechanically inclined in that way. I know a few things and stuff like that, but I'm a mechanic of the body. And I have 3 decades in healthcare, that proves that, and a license, an active duty registered nursing license, and everything that I get renewed. Even starting next month, I have to renew my license. It's every 2 years and stuff. So these hands are certified. They're Department of Justice and FBI certified. And all of them nurses, giving a shout out to all them nurses out there working hard, keeping them licensed, and stuff. This is what we do and everything. So before I get started, because it's a good topic and I got some good stuff for you, powerful stuff and everything, let me go ahead and read my podcast disclaimer. And it goes as such. The podcast is for informational and educational purposes only. It is not intended to replace professional medical advice, diagnosis, or treatment. Always consult with your physician for any medical concerns. If you have a question about a medical condition, reach out to a qualified healthcare professional. I always say your doctor. Never disregard professional medical advice or delay seeking it because of something you heard on a podcast. With podcasts being so out there and everybody's on, everybody's doing something, you have to choose who you will see, or if you see all of them. Thank you for the door and the squeakiness. Thank you. I appreciate it and stuff. Guest views are their own and may not reflect the views of the host of the host, which is me, or this podcast. And what else? Oh, the information shared is for general knowledge. It should not be used for any legal or medical purposes. Okay. And then always consult with a licensed professional who knows your medical history for a meaningful evaluation. And guys, stay informed, but always seek professional advice when it comes to your health. Always seek professional advice. The doctors are not dumb. The doctors are not nosy. Even the nurses are not nosy and stuff. They need to know something, just like a crime scene investigator. They have to knock on doors and canvas. Did you see this? Did you hear this? Did you do this and stuff? We got to do all of that in order to investigate what's wrong with you. Why, even if you ask me, some of the people that know me and know me as Charlene the nurse and all of that stuff like that. Even when you ask me, I'm wondering if I had this rash. Well, what did you eat? I ain't gonna just say, oh, that's so and so and such and psoriasis, or so. No, I can't diagnose you. But if I see a rash and it just popped up, did you use a new kind of cream? Did you wash your clothes in something different that you normally don't? And stuff. We got to find out. We got to investigate. So y'all welcome on in. I see welcome on in Auntie Josie. She said, hello, everyone. Just checking in. Thank you for coming on in. You stay as long as you can or as long as you like, and feel free to get on in there. And it says Miss McGraw and stuff. I know that's Trina's auntie, I think, or Trina's cousin and everything. My god sister Katrina cousin and stuff. I remember you, baby. And stuff. Welcome on in. Thank you. She said, hello, everybody. Yes, that's right. And stuff. Come on in, y'all, and stuff. We all on here and stuff, and just learning. It's a medical. Oh, Trina's cousin. Yes. Is it Tammy? You tell me. Because it has another name for your other name, Foxy Nana. And stuff. But yes, I think it's Tammy and stuff. But I remember you and stuff. But yes. Oh yeah, it's Tammy. Welcome on in, baby. And stuff. But yes, I'm just on here. It's called Medical Talk in Layman's Terms with Nurse Charlene. And of course, I'm Nurse Charlene. And I just come on. Sometimes I have guests on. Like last week, I had my son on, and we were debunking supplements and everything. But we talk about everything from head to toe. We talk about mental illness. We talk about drugs. We talk about the unhoused, or formerly known as homelessness. We talk about, you name it, we get known here. If it got something to do with your mind, body, or spirit and stuff, or physical body, and everything and stuff, we talking about it and everything. So that's what we on here doing and stuff. So tonight's topic is eating disorders, when food just isn't food. It's not just food. It's easy. Just eat. It's easy. Don't eat. It's easy. Just go on a diet. It's easy. Don't go on a diet. Yeah, no, it's not easy and stuff. It's a whole mental thing and stuff. But let me dig in and stuff and get you guys started. And at any time you got a question or something like that, even if I can't answer right offhand, with certainty and stuff, I will be sure after the live is over, which is in about an hour and 15 minutes or so. you can go back and find your question and stuff, and it might be something that helps somebody else that's too scared to ask the question and stuff like that, and I'll answer it and everything. And you guys be having some excellent questions and stuff, so feel free, dig on in. So I said eating disorders, when food isn't just food and your body is a snitch, believe it. That's my LLC. That's who I am and everything. And this is the reason why, for these reasons. What are eating disorders? So the definition, I got to give you a definition because it's medical talk in layman's terms with Nurse Charlene. So layman meaning keeping it so simple that somebody that knows nothing about healthcare can actually understand what I'm talking about, the words that are coming out of my mouth. And so instead of saying stool, sometimes you might catch me saying something. It might seem unprofessional, but not in this setting on this podcast, because I'm doing it in layman's terms. So I might not say stool. I might say poo-poo, or something like that. I might not say urine or urination. I might say pee or peeing, and everything. So if you could catch on to that and stuff, I might not say vomiting or intractable vomiting. You might not know what that is unless you're another nurse that's on here and everything, but throwing up, and stuff. So if you look at my board behind me, I try to do like cartoon like figures, but it's saying stuff, like one is food. That's somebody throwing up into a toilet, and everything. This is junk food and stuff, pizza. Yeah, it's foodish. You can get some type of nutrient out of just about anything. Even my son, we looked up, you could get some trace nutrients out of a Twinkie and everything, just the way they put them together. But you get less nutrients and more garbage, more garbage than the nutrients. But yeah, you can get it out of a Twinkie. You can squeeze it out of a turnip and everything. So that's where that comes in. Over here is that's actually a plate with a sad face, like I hate food, it always acts up, it always make me fat or make me too skinny or something, and everybody forcing me to do it. So it's handcuffs, and those at the end is handcuffs, and then that's a spoon and a fork, and stuff, and a chain is chained to a handcuff, because you got to eat to live to eat and everything. And then you got you a happy person, they talk about the food is good, and you got one saying yuck, I hate food, and stuff like that. Why do you hate food? Well, I'm about to tell you. So eating disorders, or EDs, are serious medical and mental health conditions where a person's relationship with food, body image, and self-worth becomes unhealthy, obsessive, or dangerous. That's crazy, right? Food's supposed to be good. Like everything else, there's a problem, and everything. Food got its problems and everything. Not food itself, but how we process it, how our body takes it in, how it's traumatized us or not traumatized us, and all that different things. So another thing is, they are not about vanity or willpower. This, being disrupted with food and everything, it's not about vanity or willpower. They involve the brain, hormones, emotions, and behavior, all these different things. But you'll understand as I go along. They affect any age, like that kid that only will eat chicken McNuggets, and stuff. I know it seems cute now and stuff, but what's in chicken McNuggets? But anyway, age, gender, race, or body size. So it's not just, the fat people, they eat all. No, sometimes they don't eat. They got something else wrong with them and stuff. It makes them blow up, where they can have one banana and blow up and gain 10 pounds, and you can have a banana and you just fine with it. You just got you some potassium. You see what I'm saying? So it's not even about what you eat and stuff. It's about what your body is doing inside. And then that causes psychological problems. And then you got hormones going on. You got all this stuff because your body is this big old giant well-oiled machine, the human body, from a baby, newborn in the body all the way up, and stuff. So it's crazy and stuff. So now I'm going to give you some most common eating disorders. Not to say everybody got this, but these are the most common. So if you do have it, you're not alone. A lot of people have this one. So you got some work to do. That's all it's saying. But you got some work to do if you don't have none of these that I'm going to name off, and you got some stuff. I got some work to do. And I haven't been diagnosed with any of them and stuff, but I still got work to do. So I'm going to sit here and learn right along with everybody else. Okay, so the number one on the most common eating disorders, it's called anorexia nervosa. Oh, you so bony and stuff. You anorexic. Well, do you know what that means? So don't look down on them and stuff. Yeah, you so bony, you anorexic. But let me tell you what it is, okay? And that'll make more sense. Anorexia nervosa, or being anorexic, is a disorder marked by intense fear of gaining weight, distorted body image. That means a messed up view of yourself, and severe restriction of food. So they're actually really smart, smart, but in a bad way that's detrimental to their health. But they're smart because they restricting their calories. So that means they're counting calories. That means they're ahead of you, and stuff that might not know, something, or they ahead of me and stuff, because they know that I can't have this. It has too many calories. It has this. They benefit from that box where it say on the back and it say 300 calories or 48 calories per serving and stuff. They know how to read that. You might not know how to read it. You know what I'm saying? I might not know how to read it, and stuff. So that's why I'm saying they're actually smart, really smart. They could be a doctor or a nurse or something. But anyway, key features of anorexia nervosa: extreme calorie restriction. That means they're cutting their calories so that they don't gain the weight, because they already have a bad image of what their body is supposed to look like. When they look in the mirror, although they barely have any muscles or anything, or just they can turn sideways and disappear and stuff, they feel this way, and stuff about their body, that they're 300, 500, 700 pounds. They see a big giant person, so it's already distorted. It's already a problem, and everything. But at the same time, they do extreme calorie restriction. They have excessive exercise. So they exercise and they're not even putting in the calories. You need the calories to give your cells energy so that your body can move properly and stuff. And they're working on no energy and still exercising. They find a way to do it. And they kill off the rest of the little calories that they might have in their body. And so their body starts to eat itself. That's not good. But I'm just saying, they're still smart. And they still can think of it. They still restrict their calories. But that's the excessive exercise and seeing oneself as overweight despite being severely underweight. Wow. Welcome on in, Rosetta Granny Allen. She's watching. In Jesus' name, amen. Let's go. Teach, nurse, teach. All right, amen. I will teach. Yes, that's my mommy. I love that woman. And so the danger level, it's the highest death rate of all psychiatric disorders. So guess what? An eating disorder is a psychiatric disorder, like schizophrenia, like bipolar, like all these other ones, depression and everything. It's an actual psychiatric disorder. So they can't all the way help it and everything. It's a learned behavior. They mentally learned it. Okay. So number 2 of the most common eating disorders that you might have heard of, bulimia nervosa. And it is a cycle of uncontrolled indulgence or binge eating followed by corrective behaviors to undo the eating. So they do a whole bunch of eating and then they try to fix it. So they already know in their conscience or in their heart of heart, yeah, I'm not doing this right with this food thing and stuff. But okay, so I'm going to explain to you what that means. So when I say corrective behaviors, they include, so binge eating, like I'm just going to binge watch Netflix. That's a binge. That means you just watching show after show, season after season, episode after episode, and stuff like that. That's binge watching. It don't have to be Netflix, whatever, binge watching TV, period. I'm going to binge on social media. I'm just going to stay on there and scroll all day till my neck get, caught up and all of that type of stuff, and all this stuff. And you're doing this and everything. That's binge social media. I'm on Instagram. I'm on this. I'm on that. I'm on this. I'm just saying I'm on those. But anyway, and so I'm just saying I'm human just like you. I be want to binge a little something on this or something on that and stuff. I didn't watch stuff all the way until all the seasons went by and everything, all the episodes went by. Some of them I went to sleep on, but I still got on down, woke right back up and continued the moseying along. Okay, so it's something, don't see yourself as the Martian. Just say it happens and everything. So the corrective behavior is you're eating too much. I'm so sad. I'm just gonna knock off. I'm gonna binge eat some ice cream. That sounds nice enough. It's just some Rocky Road. It's just some, strawberry ice cream or whatever you like and stuff. Toffee, whatever it might be and stuff. But when you knocking off a whole pint to yourself, you not only setting yourself up for diabetes, but you setting yourself up for a whole bunch of stuff. But that's the binge eating and stuff. So that's binging and stuff. When you're eating it, instead of, it's 10 pieces of chicken, you only need 2 to take care of your serving or whatever and stuff. The average person, 2 pieces of chicken or something like that. That should be reasonable for a child, 1 and stuff. What if you ate 10? Because you didn't want nobody else to have none. It's your favorite kind. And, I'm just bringing it up. I just said chicken. But anyway, I'm saying this to say, it's your favorite kind. So you ate the whole bag, the whole 10 piece, and stuff. And then all the little helpings with it. You just binged all that food and it's a meal for 4. You only 1. So why you eat everybody else's serving? You know what I'm saying? So that's what I'm trying to say. You binge eat. But then you trying to correct it like, oh, I shouldn't have did that. What am I going to do? Correct it, huh? So the corrective behaviors would be something like vomiting, throw it back up. If it haven't went nowhere, you ain't made a turn with it yet, and stuff, throw that stuff back up. And then, you can go ahead and get on down. If you do it enough times, you can eat up the enamel on your teeth because all the acid that's coming from your stomach, like we talked about on last week's session and stuff, which is called hypochloric acid that's in your stomach. That means the pH balance on it is very low. It's acidic and stuff because it's meant to break down food and stuff like that. So since it made it on down there and at least made it into your stomach, and you full, you feel like you're going to burst. And so you say, yep, I'm going to burst by bloop. And I'm going to just throw it back up. Throw it back up in that toilet. And then guess what? The food come back up. Oh, maybe that might be a good thing. And all that acid that's in your stomach come right on back up there, burning your food tube. that the food's supposed to drop down this tube and then it drop in your stomach and stuff. Yeah, you're gonna bring all the food plus that acid, and then come on back up, and then it eat away at all your teeth and stuff. You lose your teeth and everything, and get on down and stuff like that. That's a problem. Okay, I see my first big question or something. Auntie Josie said, my grandson is 9 and he is always vomiting, and a doctor gave him some nausea medication and said they're going to check back with him in a month. They said he might be overeating. It's a possibility. And remember, I just said when I read the definition of eating disorders that it can affect any age, any gender, any race, or any body size. So I want to dig back into that, Auntie Josie. That was an excellent question because it's right on time with what we're talking about tonight and everything. So there could be a couple things going on. He could have like a nervous stomach, or something, and that might be something to look at too, because remember, this is psychological. So this is your mental illness or mental health, involved in this. And so that with that being involved and him being a baby boy, everybody can get it. You know what I'm saying? So even him being a tender age of 9 doesn't make him, at less risk. He could be 8, 7, 6, 5, and stuff. And nowadays, with hot Cheetos and all that cheese, and we don't know what's in it, all that processed foods and stuff like that, this can very well be a possible eating disorder. It depends on what's happening with him. But if he's always vomiting, is he doing it to himself? Or is he just nauseated, or the thought of food kind of irksome, and stuff? So it's some things that could be going on. So we're gonna dig deep into that. But that's definitely a good question. Thank you, Auntie Josie. And stuff. So going back to the bulimia and stuff. So one of the corrective, so-called, it's not a corrective behavior, but this is what happens in bulimia nervosa, is you eat a large, extremely large amount of food, like overeating, and then sometimes a person will feel guilty. It depends on the age too, because the kid probably don't know how to feel guilty. They probably don't want to gain a whole bunch of weight and stuff, but they don't know how to feel guilty about it, and stuff, because it's bullying involved and all of that and stuff. So we're gonna dig deep and everything. But vomiting is one. That's sticking your finger down your throat after you just pushed all of this stuff, and now you're pushing up all that food, and it's coming up with bile, which is the stomach acid that's in your stomach to break down food. So since it didn't break down and go through your intestines and go through the regular way of going, down that way, it came back up through your mouth. So it's eroding your teeth and everything with constant doing this and everything. But also another way of correcting it, they take laxatives. So say they let the food eat the food, they didn't throw it up, they let it digest, however long that takes and stuff. It probably take hours, and it probably stresses the body out and everything and stuff. But then they take a laxative and poop it out, because a laxative will help you not throw it up but poop it, send it on through, take you through it, and stuff like that. Then there's also fasting. Now, in religion, there's a fasting and everything, and that's a covenant with God, and stuff. But, there's other kind of fasting, like people tell you to get your labs done, like the grown-ups, you could relate to this. Get your labs done, but nothing to eat or drink after midnight or something like that. Don't eat at least 4 hours before you get your blood drawn and everything, because they want to fasting glucose. They want to fasting this or fasting that. So when they say fasting, they mean omit eating, or do not eat until after you get the blood drawn. Then you can have at it, and everything. And so that means that they could get a mean number of what your body is really doing and stuff. And so that's where that comes in. And then also excessive exercise. That means you doing too much, and you're trying to correct. I ate all that ice cream. I ate all that chicken. I ate a meal for 4, and it was only me, and stuff. You already know you did it, and stuff like that. So then you try to over exercise to try to burn it off. but you already done damaged your body. So it doesn't matter, if you exercise like hell, and stuff, you already damaged your body and stuff. So that's where that comes. And then this is the funny part about bulimia nervosa is weight may appear normal, making it harder to detect. That means you might be the right size as a kid or adult or teen, and so on and so forth. And you might look the part. You might look healthy and stuff because everybody thinks when you have these eating disorders, everybody looks, a certain way, like, oh, I know what you got, and stuff. Yeah, sometimes they can hide it. And then other times, with like a more extreme one, which is a high death rate, is anorexia, and stuff, where the person sees themselves as big and they're not. They're really, really severely underweight. It's like, you can see through their skin, and everything. So it's very unhealthy. And it's like almost the opposite of what an anorexia is to be a bulimia nervosa. And then another one it's called BED, or the acronym is BED, BED, and it stands for binge eating disorder. So there's another binge eating and stuff, and that one is repeated episodes of eating large amounts of food in a short time with loss of control, but without purging. So they don't stick their finger down their throat, they just put it on in. And it's binge eating. That means they're overdoing it. And I can relate this one to all that Cheech and Chong type thing where you smoking the weed and stuff, everybody's smoking a little weed and everything and stuff, and then they get the munchies and you think it's cute, oh, it's cute, they got the munchies. Yeah, it's not cute when it starts turning into something. And now you got diabetes. Now you got all of this stuff because you ate a whole steak. You ate all of this stuff. You ate everybody's meal and yours, and then snatched their stuff and deboed them and knocked them from the table and ate their food too. Ain't no leftovers, and all of that stuff. And you don't throw it up. I ain't wasting that food. It's in me now. Let it digest or whatever it's gonna do. You're putting strain on your heart. You're putting strain on your gastrointestinal system. You putting strain on your genital urinary system or GU system, GI system, GU system. You're putting strain on every part of your body by doing this. So it's not good at all. It's special. But I got some stuff for you. So common feelings after binge eating. This is binge eating disorder. That's when you just go on a bender. You hitting it hard, but you ain't even throwing it up. I'm not giving it back. I'm gonna eat it. But your body is like, what the heck did you do? Like, oh my God, and stuff. That's where that comes in and stuff. And the things after you didn't ate all that food, knocked everybody away from the table. Everybody's scared to eat. They done went and got them some noodles and stuff because you didn't ate all their dinner and stuff like that. And so I'm just making light of it a little bit and stuff. It's no light of it. It's 911. But one thing psychologically, you feel ashamed. Why did I just do that? What's wrong with me? What? I'm broken. Why did I do that? Shame, guilt. What the hell? If I keep doing this, ain't nobody gonna want to be around me. They gonna all hate me, and what? I'm just saying, emotional distress. That's pulling at your heartstring. That's making you sad. You feel sad. You feel bad. You feel depressed even, and stuff. I said sad, depressed, depressed, sad and everything, but it's bad. And it's one of the most common eating disorders in the United States. Guess who did it before? Bam! I told you I was human now and stuff. I'm just trying to be transparent so that that, it might not be you, but I got on down a couple times. If it was something I liked and stuff, I got on down. I didn't want nobody else to have none. I'm guilty. and stuff. So I'm saying all of that to say I'm also a human being. Get off your own back. Okay, so another common disorder or eating disorder would be this one is called ARFID, or avoidant restrictive food intake disorder. I know. What is it? ARFID. I don't know. It's ARFID and stuff, and that is avoidance or restriction of food due to body image, but due to sensory issues. So that means, the the thought of it, if it got a certain consistency, I don't like it. I don't like milk because it's kind of creamy or something. It's not just like water and stuff. I don't like it, and stuff. It's an issue. So it's a sensory issue. It's also maybe you had a trauma like choking or throwing up right after you ate it. So now I'm never drinking milk, and stuff. Maybe I'll try a different kind of milk. It might have a different consistency. So maybe I can get down with this one, but I'm never doing this one and stuff. I have a family member that said something about they're allergic to bananas. So I always ask, and everybody look at me like, you so stupid and stuff. I'll be like, is it anaphylaxis? Because that means you allergic. That means your throat then closed up and you got a problem. You about to die from it. Or is it a sensitivity? Like eggs give me gas. Milk, I'm lactose intolerant because milk, it always give me the bubble guts and stuff. I'll be all gassed up and hurting and stuff every time I drink milk by itself, and stuff like that. So it could be that sensory and everything. So the fear of vomiting. Every time I drink milk, I throw up. It just make me sick to my stomach. So sometimes it's just a sensitivity. And then sometimes if it's anaphylactic, you in trouble. You need a EpiPen. That's like somebody being allergic to nuts, peanuts and stuff like that. They got a peanut allergy and stuff. That means that their throat will close up to where they will not breathe anymore, which no breathing, no aliveness. You die, and stuff like that. So it's a difference and everything. So I'm allergic to this and I have a sensitivity to it. It's two different things and stuff. So just, if you could remember that for reference, just because you don't like meat doesn't mean you're allergic to it. You don't like meat. Some people don't like vegetables and fruit and stuff. Doesn't mean they're allergic to it. They don't like vegetables and fruit, and stuff. They got a sensitivity to it. Maybe it did something to them, like fear of choking, fear of vomiting it. As soon as I ate a carrot, I threw it up. Okay, well, carrots are good for you. What's wrong with you? As soon as I ate a carrot, I threw up. Enough said. It's the other orange things I can eat and stuff to put whatever that is in there. So you see what I'm saying? That's where I'm trying to go with that and stuff. Some is trauma related, like getting something stuck in your throat, especially in the older folks and stuff. They can't chew anymore. Maybe the denture's not getting down like they supposed to, or their chumpers are not strong enough to bite down on something really crunchy or something like that and stuff. So then, they could have choked or could have went down the wrong pipe or something like that. And that's where, other food traumas or even liquid traumas. So they have to drink thickened liquids and different things like that and stuff. It's just a matter of how it goes, and stuff, depending on what's happening with you and stuff. So, and these, this avoidant restrictive food intake disorder is common in children, but also in adults, and everything. So sometimes you'll find a kid that'll only eat some type of vegetables and salads or something like that. I know it seems strange, but they'll do that. They'll do fruit and they won't touch no meat unless it's a chicken nugget. That's not meat. But anyway, or they'll only eat meat, and stuff like that, or certain meats, and they won't touch anything else like red meat or something like that and stuff. It depends on the child or the adult, and stuff. Some are vegan, some, didn't start that way, but they're vegan. They're not allergic to meat. They just don't have a tolerance for it anymore. And they change their lifestyle and stuff to suit that. And that's fine, because it's a lot of sicknesses out here, which I'm not going to give it away. Okay. So then there's one more that I want to talk about, and that would be your it's called OSFED, or other specified feeding or eating disorder. That means all the others, and stuff that come along. And these are clinically significant eating disorders and behaviors that don't meet full criteria as the ones above that I just talked about. And this is like a little other area, and everything. That's why it starts off with other specified feeding or eating disorder, meaning the other kinds, and stuff that aren't bulimia and anorexia and binge eating disorders and stuff like that. And the risk factors, they're multi-layered. And so I'm gonna give y'all first big old giant word that I can't stand them sometimes, but they're medical. But because you're on Medical Talk in Layman's Terms with Nurse Charlene, I like to break down that type of stuff and everything. So I want to keep it simple. So I'm going to give you a word. Eating disorders are biopsychosocial illnesses. I know y'all all knew what that was. Could y'all tell me? Somebody get on and tell me. Okay. Well, I'll go to it. I thought you never asked. So guess what? It says biopsychosocial illnesses. That's what eating disorders are. So guess what? Bio is biological. That means it's in your genes. It runs in the family. So it's genetics. It's a brain chemistry, just like with other psychological disorders and stuff. It's a chemistry where something is not passing the blood brain barrier and stuff like that. So certain things that your chemicals inside your head that makes you think the way you think and do what you do, and everything and stuff. So that's where some of it is. So that's why they call it biological, because it's genetics, it's brain chemistry, the stuff, chemistries in your head, and also hormonal imbalances. That means certain things are off. For men, they have a big deal is their testosterone. But for women, it's estrogen, and progesterone, and stuff like that and stuff. So we got these chemicals in our bodies, in our human bodies and stuff. For males, it's one kind, and for females, it's another kind. And then we all got some together, that we both share and everything. But all those imbalances, they will cause you to go into this eating disorders, and everything. So that's biological. So I said it was called biopsychosocial. So bio is biological. Psychological is the psycho. And that is perfectionism, trying to be perfect, and stuff. That's actually a mental illness, trying to be perfect. Who's perfect? And who told you get to be perfect, and everything and stuff? You get a chance to mess up because we're human beings. But some people don't believe that. They want it, you see it. I don't know if anybody's ever seen the TV show Monk and stuff, where he was severe OCD, to the point of it being a problem. He couldn't have people touch him and all of this stuff. That's a severe case. And they made a whole TV show out of it with super amount of seasons and all of that stuff. It's crazy, but that's a real thing and everything. So, and then also, I don't know if you've seen him line up his food and everything. That was the most extreme thing I've seen on TV in a long time, and stuff. And it's an old show. I'm probably dating myself. I don't care and stuff. I'm a human. But anyway, the whole moral of that story is perfectionism. It sometimes comes off as appearing like a OCD, obsessive compulsive disorder and stuff like that. Also, there's anxiety and depression. So anxiety is that fear of something. and everything. And depression is that sadness, overwhelming sadness and stuff. So those two together and stuff, that's the psychological stuff you deal with when eating and end up developing a eating disorder. Okay. We're all guilty of some type of eating disorder. Even if we didn't stay doing that and stuff, we're still guilty of it. And then there's another one that's trauma induced, where something bad happened around food or around not eating or eating too much of it and stuff. And then abuse, like being restricted all your life. So now you don't never you I don't care about diabetes. I don't care about nothing. I'm gonna eat, and stuff like that. And it was maybe some trauma induced from when you were little, and stuff, because the person that raised you didn't know to do anything different. Or overeating. They always take you something to eat, on upstairs, or something like that. And you always have food, lots and lots of food, lots and lots of food. And now maybe you don't, or maybe it got you really, a size that you didn't want to be, and stuff. So it's trauma or abuse. And then another one is low self-esteem, like eating so much that nobody want me, I'm so big, and stuff. And this could be man or woman and stuff. So not just because I said nobody want me, I'm so big and stuff, but I'm saying that to say that having that low self-esteem, like, well, nobody want me anyway, so I might as well just eat until I die, you know. And it's really literally, they'll say that. And you're like, no, they shouldn't think like that. Yeah, they shouldn't, but they do. You can't fix their brain and their chemicals and hormones and imbalances and all of that. Yeah, that happens. It's really a thing. So I said biopsychosocial. So biological, psychological, and now social, which is your environment, which you're around. Not social media necessarily. Well, it could be too. But it's your social, your ethnicity. We grew up, with soul food, and stuff like that. And soul food, you got a spread. You got your fried chicken. You got your you got your turkey, your ham, your collard greens. You got your so and so. I'm just saying that because that's what my soul food look like for me and stuff. But it's also different ethnicities. They have a spread of all what they eat, and stuff. It doesn't matter what they eat. It doesn't matter what I eat or what I've ate, and stuff. I'm saying the whole point is they got a spread of what they eat, and stuff. Some people, I was watching this Bizarre Foods guy and stuff, and he goes to these different islands and all this off the beaten path type stuff. And they had worms that they went and cut out of a tree, and these big old worms, I wouldn't eat them with a 10-foot pole, and stuff like that. But I'm saying this is their food, this is their protein. So they eat it on a leaf in a dirty wooded area, and stuff like that. And that happens. That's the thing, and stuff. So that's where that comes in at and everything. Also, so the social environment, it could be diet and the culture, and stuff. Some people eat way more than others, and stuff like that, because that's a part of what they do, and everything. It doesn't matter. It's a part of what they do. And social media plays a role in your social environment and everything. So you seeing, Cardi B, and you seeing Rihanna and all of that. And what I it confused me a couple times and stuff. I see these women, on there, but they're celebrities now. They live in a different bubble than us and stuff. And no harm or hate to them and stuff. What I'm trying to say is they have babies and be popping out. Rihanna be popping out babies and got body yaddy yaddy. So I'm like, how you pop out a baby and then now your stomach is flat and you taking a picture on the beach or something somewhere or some rich place or something like that, and your stomach is flat, there's not a stretch mark in sight? Are you a Martian? Like, what are you, and stuff? What did you do? What kind of surgery did you have? What kind of surgery didn't you have? Oh, that because you had a chef, a personal chef? Like, where does this stuff come from? But that's why I'm saying about social media, you got to watch out. You got to watch out, and stuff. Where did it come from? And stuff like that. Um, it's just so many things, and you're like looking at these people and stuff like that. And I'm not gonna name the celebrity, but I saw a celebrity without their makeup on there, like, look, no makeup, look at me, and stuff. And I was like, ooh, and stuff. And I seen the dark circles, meaning underhydrated, under sleeping, not sleeping enough and stuff like that. They look like a shell of what they were supposed to look like. But then 5 minutes later, they're going to the Grammys or they're going to the Oscars or something like that. And they put that little makeup on and stuff, and they look like a whole different person and stuff. And then I've even watched that on social media where a man would get on and then do all the little makeup and stuff, and then they look like Whitney Houston or something like that, and you like, what the heck is going on here and stuff. But that's how we're fooled. If you got enough money or skills and stuff, you can do all of that stuff. And yeah, it's up to you to believe it. Do you believe you? Do you just look 100% beautiful overnight? Like, this is another scary thing. I'm on this social media and stuff, but this is the messed up part. I've had a fear of speaking, public speaking, and then a fear of people looking at my face, and looking at me and stuff like that, and all of that stuff. And I pushed all of that away just to be on a public forum, because I felt the need to get you this information was more important than my need to worry about what if I get a pimple right here, or what if I get this, or what if I get that, you know what I'm saying, and stuff. So it's like this stuff is really a thing, and it's psychological and everything. Sometimes you got to push past all of this in order to get on and present yourself, and this is the number one thing. Would you come on with me and stuff? You a nurse, all of this and stuff, girl. You got 10 more years than me and stuff, like, would you come on to my platform and speak and be my guest speaker and everything? I don't want everybody looking at my face, or no offense or anything and stuff, but I even had somebody tell me, oh, you already talk too much anyway and stuff. You'll be a good talk show or podcast or whatever that is and stuff. I'm not getting on. So that means you gatekeeping, because you know a lot of stuff, and it will benefit some people. You could save some lives, like I'm doing right now and stuff, by getting on and stuff, but they won't even get on because you ain't gonna be judging them, and stuff like that. But guess what? You ain't judging me either and stuff, because I'm not letting you. But you feel free to watch, feel free to learn, because I'm coming on for that, and that's where my heart is and everything. So I don't know how I got off to that and stuff, but I'm just saying the social media. So the social part of biopsychosocial is the social environment. So that's your diet and culture. That's the social media and all of that stuff. That's how I got onto that. And then there's a weight stigma, which you're supposed to be. If I'm 5'6", I should probably be, 140 pounds or something like that. And that might not be realistic for me. Maybe when I was in my 20s and stuff like that. But yeah, I'm 20 plus, maybe 20 plus almost another, something. But anyway, I'm just saying, that's what it is. It is what it is. Family dynamics, and everything. If you're the mother, you're the matriarch, you're the so-and-so and such, all of that plays a role. Also, sports and emphasizing weight. Girl, you so tall, you could be a WNBA player. But I want to sing. I want to be a model. No, you could be a you see, you got big feet and big hands. You need to be a WNBA player. But I don't want to be. Well, that's what you're going to be, or something like that. Or that young man, he's now 15 years old and he's 275 pounds, kind of muscled up, and everything, but, a little fat, but a little muscle, but a little fat and everything. But you 15. You got hair on your chest and you got a goatee, and stuff, and you 15 and stuff. You see what I'm saying? He gotta be a football player. He gotta be. You can't be nothing else in this world. But I want to do the ballet. I want to be a dancer. No, you big, and stuff. You're gonna be a football player. You see where I'm saying? Yeah, that's where the stuff comes. They drop that seed and you gonna be that. And that's the end of it. We don't want to hear nothing else. And then they end up confused and everything about their everything, including sexuality and all of that type of stuff. And then, there's like they want the little girls to be gymnastics, but they want to play basketball. But you only 4'8". You could be a gymnastic. You'll be, you small enough to be a gymnastic girl. But I want to be a basketball player, and stuff like I brought up Simone Biles because Simone Biles, she's 4'8" and maybe about 100 pounds or something, but she got a big old giant husband that's a football player and he's 5'9", 5'11" or something like that, and a big old guy and stuff. That's a grown woman. I don't care how little she is. She's a grown woman, and stuff like that. So at the end of the day, it look weird, but it's not. That's a grown woman with grown woman tendencies and grown woman problems, and everything. And now she's married. So now she got wifey problem, situation and husband problems, or whatever that looks like and everything. So saying all that to say, just, judging somebody like Charlene, you 5'7", you should be blah 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 and so and stuff. Yeah, I should be, but I'm not. So what? You gonna determine what I'm gonna do? You gonna raise me? I'm grown now. It's too late and stuff. So that's the whole moral of the story and stuff. And then I was just gonna do age groups. I'm just gonna do a run through them real quick and stuff. And I'll probably try to get off of here early for you guys and stuff. And so children and adolescents, the problems they have with eating disorders or developing one is early dieting. You already too big and stuff. You better take these carrots and go to school. You get some tuna. You ain't getting no burger. You not to go and buy nothing at the lunch counter and stuff like that. You gonna eat what I tell you to eat, or something like that and stuff. Bullying because they're too big, so they get picked on because they're too big. So then they try to become a bully, and start knocking the hell out of somebody and stuff because either get bullied or tear them up, and stuff. And so either way and stuff, nobody wants them or nobody wants her because she big, and stuff. She either knock the heck out of somebody or get beat up, and stuff. And then that pressure of sports. Oh, you so tall, you could go into this. You could do this and you could do that. What if they tall like a basketball player and they turn out to be a very excellent martial artist, and stuff like that. Yeah, martial artist is a sport. Oh, they were supposed to be a basketball player, because they tall. Yeah. Okay. And so that social media exposure, can stunt their growth as children, getting on there TikTok and ticking, or whatever and stuff, and their brain development. So sometimes they're not even ready. It stunts my brain development, and I'm fully grown and stuff, and it stunts my development, So I know it's gonna stunt a little kid that can't even handle it and can't even handle their hormones yet, but they on there getting down Roblox and different things like that. It happens. So the moral of that story is anybody can get it. It doesn't care, and it's not gonna pick the old person, it's not gonna pick the super young person, it's not gonna pick the medium size, it's gonna pick them all and everything. So that was children and that's adolescents at risk for becoming developing a eating disorder. Then you got your young adults, that will be your 18 to 30 And that would be somebody, college stress, what college I'm gonna get accepted in, and blah blah blah. What my family want me to do, what this want me to do, that want me to do, and stuff. Identity issues like, am I straight, am I bi, am I pan, and all of these different things. Am I a gender, transgender of some sort, and stuff like that. That's where all this stuff comes in at. And guess what? That depressed person that had to hide all of that stuff inside, and grow up and everything and stuff, then they could later develop a whole bunch of problems, and everything. And then that comes into play and stuff. So then, what else did I want to say? Body comparison culture, comparing myself, to, one of these celebrities or something like that. Yeah, we don't know what they're doing behind the scenes. We don't know the nip tuck. We don't know the spanks. We don't know the, everything and stuff. Just like, the Magic Mikes, they get on there and they got these little bodies and the 18 packs and 18 wheelers and whatever and stuff like that. And they rolling and stuff. And then somebody else that, is trying to do right and stuff. And they looking at them like all the women want that. So I got to thug up and do that, or be the nice guy, and stuff like that. So it doesn't matter. It's an equal opportunity loss, in other words and stuff. And then your adults, and that will be 31 to 60 plus, and their life stresses of developing an eating disorder would be life stresses like divorce, some type of grief, a loss of someone, a child, a spouse or something like that. Illness, having this illness my whole life and dragging me. I'm in a hospital. It's like I don't even have a life. I'm in a hospital, and then I'm out for a little while, and then I'm in a hospital, and I'm trying to, balance it and look like I'm fine, and I'm not, and stuff like that. Chronic dieting history, the roller coaster. Oh, I was big, and then I got on down. I got on down, then I'm back big again. Yeah, it happens. It happens. And then there's menopause and hormonal changes. And remember, with menopause, there's also andropause. So that's male menopause, and stuff, but it's called andropause and stuff. So that hormone and the hormones after 31, it starts decreasing 1% every year after the age of 30 and everything, and that happening and stuff. So that's like, wow. And so that means after it decrease, now you 50, it didn't decrease all that time from 30 to 50, and stuff like that. So it's special. I'm just saying. And then a lot of this stuff goes underdiagnosed because they don't know how to put it in the right, category. And then you got your 65 plus, or something like that. And that will be medical illnesses. And they try to hide them, what is that, Medeas and or different things like that and stuff. And so they're trying to hide the fact that this is happening and stuff like that. And that becomes a problem. Also, the isolation. You old, and stuff. Nobody want to come around. And so they get, old and bitter and stay in the house. They don't deal with nobody, probably develop smoking cigarettes to cope. They're lonely and stuff. And then they're old and they get dizzy when they get out in the streets and stuff. They can't drive no more and stuff. So they got to depend on paratrans or, all of that type of stuff. So this is happening to them, developing an eating problem. They don't want to get to the store. It's always somebody trying to get them for money and stuff like that. They're gonna knock them over their head for their groceries or whatever and stuff like that. So they might undereat, or overeat and stuff, or eat food that's bad, that went bad. And so they got all them problems and stuff. And then also they get the memory problems and all of that stuff, and they call that Alzheimer's. But Alzheimer's is from birth. It's a genetic thing that runs in your family, and dementia is the symptoms of Alzheimer's, like losing your memory and everything and stuff. There's symptoms, a group of symptoms, and stuff like that. So that's where that goes in. And It's just different things. So now, what is it? It's just over an hour now and stuff. So I'm gonna go ahead and get to the real meat and potatoes. Whereas there's treatments that you can do, and usually in order when once you've been identified as having an eating disorder, it doesn't matter what kind, which one or nothing. The treatment modality, it takes a whole bunch of people. It takes somebody to do medical monitoring, that might be a doctor, and then maybe a dietitian or something like that, and then maybe even a nurse and stuff. Then they got a nutrition therapy, that will be the dietary and stuff, but the doctor's writing the orders and supplying the supplements or something like that to take in addition to your food and stuff. Then you got what is it, psychotherapy and stuff, and that's the mental a therapist seeing some type of support group and everything, and then medication when needed and stuff, and there's a lot of different medications, it's a lot of different therapies and stuff, and they're all different ones. You got a trauma-based therapist, you got a family-based therapist, and that's usually for the youth, and stuff, being bullied and stuff like that, or overweight and everything and stuff like that. That's the whole thing. And then they got cognitive behavioral therapy, relearning how to think and remember stuff and do things, for yourself and everything. That it's that. And so the prognosis for this is early treatment equals better outcome. Recovery is possible, but not just a straight line and you're there and stuff. It take a little bit, you get a little bump in the road, then you got to start over here, and then you might have to make a left and then a right instead of a right, then a left, and stuff like that. And then relapse can happen. Don't be so hard on yourself. You're still a human being. Stop being hard on yourself. It's all this other stuff, devilish stuff out there that could be hard on you. You don't need to be hard on you too. You only get one you and everything. But that relapse, even though it can happen, it doesn't mean you failed. It means you need to try something else. So like, it doesn't mean you went left and then right. Now you might need to go right and then left, or right and then right some more, and stuff like that. The dangers of having an eating disorder is electrolyte imbalance. That means your potassium low, your magnesium low, your so and so. So you start getting cramps and Charlie horses in your legs, Charlie horses in your thighs, and stuff like that. You got to get all of these balanced: your potassium, your calcium, your what else is there? Your potassium, your magnesium, your phosphorus. All of these got to be in balance. These is all your electrolytes. They got to. That's why they tell you hydrate. And then dehydration, it always causes a problem. If your lips stick to your teeth, you're dehydrated, and stuff. If you're peeing and your pee is golden and almost like a 14 karat gold, you probably got a problem. You're dehydrated, and so on and so forth and everything. So then it can lead to things like fainting spells. They call it syncope, but it's fainting, falling out, face planting, and stuff. You can't help it. Something ain't right going on inside the body. You might look like you normal, but something ain't right and stuff. And then also it starts causing heart problems, and they call it arrhythmia. That means it's not the rhythm is not right with your heartbeat. Instead of your heartbeat going boom, 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 yours going boom, 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 or boom, boom, and stuff, so it's that weird stuff like that. And then long-term risk is heart failure. Like I know you've heard of congestive heart failure. It just means your heart is failing to do its job, and it's gonna stop sooner than later, if you don't control it. Infertility, so not eating correctly and always decades of dieting, the wrong kind of dieting, you might not be able to reproduce or have babies, and stuff like that. Either man or the woman, and stuff. It doesn't matter. It take two of y'all to tangle, and stuff like that. And then bone loss, they call it osteoporosis, or it's like a sponge. I think of SpongeBob when I think of it, but a sponge got all these little holes in it, and stuff like that. If your bone look like that or your teeth look like that, guess what? Them bad boys is coming out and them bones is breaking, and stuff. So it's as simple as that. Kidney failure. Kidneys, they supply urine, pee, and stuff. So if they're not doing their job and giving you pee, where's it going? That means something ain't happening. So that means your kidneys are failing. That means they're not able to do their job. They're damaged, and everything. That's a problem. It's life or death, I promise you. And then GI rupture, which is gastrointestinal rupture. That's like being dehydrated, electrolyte imbalance and everything and stuff. And then your little poop gets stuck inside your intestines. So it ain't coming out. So you can't dookie and stuff. So guess what? It's holding up the freeway. So all this other new dookie that when you is eating and stuff, it's coming. But it's a rock right there. And it's like, I'm not moving. So guess what it do? It try to widen the load on them intestines that ain't supposed to be stretching out like that and stuff. And it widen it, and you might get a couple little dookies, to slip around it, or some little soft ones or something like that. But guess what? I'm still here. Like a statue, I rise, or whatever, huh? Yeah, it burst. And if it bursts inside of you, you become toxic and you die almost within hours of it happening. They can't clean you out and stuff. So sometimes if they catch it enough to where it bursts, but you're right at the hospital and stuff, they might be able to do surgery, maybe give you a colostomy bag or something like that and stuff, or they might not be able to save you. And most of the time it's the latter. They might not be able to save you. They can't clean all of that out. And all that's not supposed to be in other places. It's supposed to be inside that poop tube, and stuff. And when it ain't in there and stuff like that, and it's visiting other places and stuff, it's damaging all of that with all the toxins. Because poo-poo is trash of your food system. And pee-pee is the trash of your blood, cleaning your blood. The kidneys clean your blood. And so pee is the trash of it. So you got to let the pee out. And if you don't pee, you die. If you don't poop and it don't come out some type of way by some means, you die, and stuff. I didn't make it up. I'm just saying this is what happens and stuff. I'm teaching and everything. So, myth versus facts, and then we're going to take home message and we're gone and stuff. And that is eating disorders only affect thin young women. The fact is that's a lie, because the fact is it affects all genders, all sizes, and all ages. A human being, period. You could tell by looking at someone if they sick, or they got an eating disorder. In fact, many people look normal and are very sick. Okay. Just eat more. Have some willpower. Yeah, that's the lie. The fact is, many people look normal and are seriously sick, but also eating disorders are brain-based illnesses, not a choice or willpower, just simple willpower. And then a myth. Recovery means never struggling again. In fact, recovery means learning skills to cope safely, because you're ineffectively or not coping properly. So that's why you develop all of this stuff. And remember, I said it's a mental illness as well as a physical illness and everything. So a few quotes, and then I'm going to get on off of here in about 5 minutes. And that is, an eating disorder is not about food. It's about pain. Wow. Your body keeps the receipts. Your body, when you don't listen to it, it's keeping receipts. And it's going to cash in on them. It's going to tell you, you didn't do this when I did this. You didn't do this when I did this. It keeps receipts. Okay. So you can't blame my body. You should have told me something. No, you got to listen. Okay. You don't need to look sick to be sick. You don't have to look sick to be sick. You can still be handsome or beautiful and stuff and still be sick. It doesn't matter. It's not about looks. Healing begins when control is replaced with compassion. Have a heart. Know that you're human. Give yourself a break. Pat yourself on the back for the little wins, and your body is not the problem. It's the messenger. It's not the problem. It's telling on it. It's the messenger. It's trying to tell you. So it ain't the body that's the problem. It's you not listening to the messenger. Okay. Take home message. Eating disorders are real medical illnesses. Okay. I'm not doing this for nothing. Early intervention saves lives. Shame keeps people sick. Education heals them. Food is not the enemy. Silence is. Let me say that one more time. That's hard. That's hard. That's gangster. Food is not the enemy. Silence is. Wow. Oh my goodness. Your body always tells the truth. Please believe it. Your body is a snitch. Believe it. It's telling. It can't lie on itself because that's his own job is to see what's going on when you not paying attention. You lifing. It's telling because it can see inside. Conclusion. Eating disorders thrive in secrecy, judgment, and misunderstanding. Recovery thrives in education, compassion, and support. Getting that support, that therapist. If we listen to the body instead of punishing it, healing becomes possible. I got to say that one more time. If we listen to the body instead of punishing it, healing becomes possible. Wow. Okay. Because your body is a snitch and it's trying to save your life. Because your body is a snitch and it's trying to save your life. It's your last line of defense. It's your last line of defense. I thank you guys all that were able to come on. If you missed it, somehow you had something else to do and all this rain and thunder and lightning and stuff. If you had something to do, okay, be it as it may and stuff. Definitely catch the replay. I'm on Facebook under Charlene Nurse Allen, and as my profile's made public. And then also I'm simultaneously filming from YouTube, which is under Medical Talk in Layman's Terms with Nurse Charlene. You can find all old past podcasts and also the one tonight and stuff. It'll be available maybe a few minutes after I'm off the air and everything. And remember that when you ask the questions, you can even go back even when I'm not on live and just ask the question if you want to know something. And Auntie Josie, I'm gonna get back with you on your grandson and stuff. Definitely that's something important and stuff, but at least you're paying attention. And had you not been coming on here to see this, you wouldn't even thought to even bring that up, and everything. But because you have been on past podcasts, you were able to identify this is a problem. Let's go ahead and tell a doctor and tell on it, and stuff. Because remember, you're at 9 years old, your grandson's body is snitching, is showing things. So even if it's not an eating disorder, because it doesn't have to be this, and we're not claiming nothing and everything, but it's showing that his body is trying to tell on it. and stuff, because it could be an allergy. It could be, things like food sensory disorders. It could be all these different things and stuff happening and stuff. So this is a big deal. And I thank you. I thank you guys for coming on. I thank you for all that were able. And if you didn't come on, don't feel bad. It's okay. Because I'm going to keep on going as long as God says, sees fit. I'm going to keep on coming on with good stuff for you each and every week, every chance I get. But at the same time, just remember, we are human. We got to give ourselves what I like the social worker that told me, give yourself grace. And one more thing, an update on my mom, Rosie Granny Allen and stuff. She gave me permission to say this and everything and stuff. So I want to say it, make no mistake, and this is not just by chance. This is just by her knowing that her body is a snitch and to believe it. Because I want to say it one more time, because it's a crazy timeline with this and stuff. But June 13th, June 6th, 2025, I took her to the hospital because she said her stomach was hurting. She was snitching on her body being a snitch. That's a symptom and stuff. So we went on to the hospital. By June 13th, so June 6th, by June 13th, 2025, my mother was diagnosed with pancreatic cancer and stuff, very deadly cancer and stuff. By July 30th, 2025, so June 13th, she was diagnosed. By July 30th, 2025, she started her first cycle of chemotherapy, the hardest chemotherapy out there for pancreatic cancer. Us nurses that's on the line and stuff, what this is and everything and stuff. So the long story short of that is she started this. Guess who dabbled in some oncology as a registered nurse with my 22 years? 22. Me. But guess what? That's my mama. Did I cry? Did I get scared? Did I all of that? All of that. But I'll tell you one thing, we talked to Dr. Jesus about it too. We had some words with Dr. Jesus. They were very respectful words, because I respect Dr. Jesus. But anyway, long story short is July, it was planned 4 cycles of chemotherapy, 2 weeks apart, and 2 weeks apiece and stuff. So she did 4. They asked for 2 more. She did 6. They asked for 1 more. She did 7. So that's July through August and September, some of September, October, November. Whatever it is, November 20th, she went in for a 6.5 hour, it's called a Whipple procedure. Most people don't even make it to that. And most people at 72 years old don't even, aren't even clear to go to that. She wasn't super healthy. She was okay, but they felt the need and they seen a fight in her eyes that even I didn't know that she had, and stuff. So what I'm trying to say is, make no mistake. I know that I'm coming on here and I'm doing my little board and, all dolled up and all of that stuff. But at the end of the day, life on me. So while I'm on here doing podcasts and everything, she was sending me home from the hospital and get me to get on the podcast, because she knew that was bringing breathing, nursing life back into me, while I took care of her 24/7 and still do to this day. The whole moral of the story is she had that 6.5 hour procedure on November 20th, 2025. She was home with me by November 26th, 2025, and in recovery and everything. And the whole moral of the story is the oncologist sat my mother down and we trying to find out, what's going on, what's next and all of that stuff. And the doctor said, Miss Allen, you're cancer free. So I looked at, I said, what did you say? Yeah, Miss Allen, you're cancer free. I said, what you say? I'm a nurse, 22 years, whatever. I said, what did you just say? He said, I said your mother is cancer free. The surgeon got it all out. So just remember, life be lifing on us. You never know. And guess what? I even had to admit it on a podcast. Everybody was like, how you doing and stuff? I know your mama going through it and stuff. How she doing and blah, 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 and so and so. And I said, I'm okay. I'm on blood pressure medicine. Because guess what? I had to snitch on my body. My body was giving me headaches. I was getting fits of anger and rage and all of this type of stuff while I was trying to life and, and everything and stuff. So remember, I kept saying, I'm human. You're human. You got to give yourself some grace. And the only reason why I stayed on a little bit extra, because you got to know that my intentions of why I'm coming on and stuff, I'm not coming on here to play with you. But I will come on here and give you enough wherewithal to say, I'm going to go ahead and tell on my body. I've been having this backache. I've been having this knee pain. I can barely get out of the bed. I can, you're not supposed to barely be able to do this and barely be able to do this. I'm not supposed to do that either, and stuff like that. But at the end of the day and stuff, I can say, it doesn't matter what's going on and stuff. They just told me my mother is cancer free. That's amazing. But look at the timeline. All behind her just snitching. June. So now it is what? February 17, 2026. And so what is that? June, July, August, September, October, November, December, January, February. Some 8 months, not even a year, not even just a little over a half a year. And we went from cancer to cancer free. It never metastasized, which means traveled all over and jumped on everything. I didn't say that this is everybody's story, because I know that different because I'm an oncology nurse. What I'm trying to say is, make no mistake, ignoring it doesn't make it go away. It just makes it worse. And then, hello, you got a problem. And so ignoring that blood pressure, you just put weight on your heart. Ignoring that blood sugar, you just made yourself diabetic. And now you got to worry about, is you going to go to sleep and never wake up because your blood sugar too high, or go to sleep and never wake up because your blood sugar too low. So if you see and catch that and stuff, that's why I'm on here. I don't know about everybody else. I can't speak on everybody else. I hope they're trying to do the right thing, but that's why I'm on here. And so at the end of the day, thank you guys for coming on. I'm giving you grace, give me grace and everything. But just remember, life's on everybody. And it don't care what degrees you got. It don't care how many years in the game you got. It can steal life on you. So y'all be careful. Y'all pay attention, because your body is a snitch, and you better believe it. Okay? All right. Thank you. And I see, let me just read this real quick and stuff. Auntie Josie said, thanks again for good information. We are blessed to have you, for the time you take out of your day or something like that here to do. And I thank you for blessing me with your presence on here and everything. And I appreciate each and every one. I don't care if it's one or 50 and stuff. The whole point is, it's going to catch fire. It's going to catch fire. Thank you, Granny Rosie. She said, thank you, Nurse Charlene. Great job. I appreciate you. And I thank you for releasing me for an hour and a half to be able to get on here and do this and still be able to love on my mama, love on them while they here, because you never know when you can be gone or they can be gone, because it could go either way and stuff. Just remember, we all ain't promised and everything. And then she said, love the board and stuff. Thank you so much. I work hard on it and stuff. And my baby, thank you, Brittany and stuff. Little Brittany talking about good job, mama and stuff. That's my little second nurse in command too and stuff. And thank you, family. You know, some people don't get on and everything and stuff, but I understand. I know you look in and stuff, and I appreciate you also. And I appreciate all my support and all my extended family and everything. I love you guys, and y'all take care and take care of yourselves. And always remember, your body is a snitch. Believe it. All right. Bye bye, you guys. Okay.